And what day is it? It is Friday, and that means it is time for our Lunch and Learn. Now, today we're going to be talking about fish oil in children and how fish oil helps with their cognitive development and helps with their social skills. Now, I didn't know this. Honestly, I'm not a big fish person. My daddy wasn't a big fish person, and so we didn't grow up eating fish. Now, we had the obligatory fish sticks on Friday at school. So we did have that, and I did have fish sticks, of course, when I was little, but as far as salmon or halibut or tilapia or whatever, I think the only other fish I was exposed to as a child was catfish. And of course, as I've gotten older and smarter, we know that catfish and shrimp and lobster are all scavenger foods. And so you're eating what they've been eating, and they clean up the ocean and the lake. So I don't know about you, but I don't want to eat scavenger food. So I'm not 100% of a fish fan. However, fish oil, we can get it really clean, and fish oil is really, really appropriate for children. And so we're going to be talking about that today. So children in the United States eat far less fish when compared to children in other countries. This lack of nutrients from fish may deter neurodevelopment of social skills, according to a British study at the University of Bristol. Now, the benefits of children eating fish also extends to the broader aspect of health, for easy research has shown that it may help prevent allergies and Crohn's disease. So if there's anything that I am seeing on the rise here at Abundant Health and Wellness, it is Crohn's disease, irritable bowel syndrome, and allergies. And so this could be why, because here in the United States, we do not do a lot of fish with our children. Now, there have been some safety issues with fish oil supplements, and we understand that, and we screen for that, so you don't have to screen for that, okay? And so we look for that, and we understand that the Environmental Protection Agency does warn against overconsumption of fish, but that doesn't mean that we should not consume fish oil. So in a study published by the European Journal of Nutrition, they found that low fish intake in childhood may result in suboptimal development of social skills. These skills support others, benefit others, instead of the child himself, such as helping, sharing, and comforting. Now, if you're a mom, you know that kids don't want to share. That's just in their nature. It's mine. I think that's one of the first words that children say after no is mine, and because they want to own what they've got. And so it might be that if we had more fish in their diet, they would have better social skills. These behaviors typically begin to form between the ages of 1 and 2 and then increase as the child gets older. Now, I will tell you, as part of our fertility protocol, we do recommend very high doses of fish oil because we know that it helps in neurodevelopment with children. So just because we don't like to eat the fish, we can definitely do the fish oil as a supplement. And when moms take it, the babies get it because that's just the way it works. Early association found that seafood intake during pregnancy had positive effects on child's neurodevelopment. But because studies have focused less on fish intake during childhood, the researchers undertook this new investigation. They examined the dietary intake from 5,969 children in order to make correlations between behavior and cognition. Behavioral scores were derived from questionnaires taken at ages 7 and 9, and then cognitive function, which was assessed by age 8. Now, I don't know if these questionnaires they asked the children these questions or they asked the parents these questions about the children, so I'm not quite sure how that worked. But they did find that lower fish intake at age 7 was linked to a 35% increased likelihood of suboptimal children behavior, social behavior, and it grew to 41% but when they were age 9. So I don't know about you, but I taught my kids to be nice. I taught my kids to play together. I taught my kids not to be stingy, all those kind of things. And so, we know as a country, we prize those things. And the studies are showing that with a lack of fish in the diet, that these children are not developing those skills. And so this is a really good thing to think about, because we want our children to be user-friendly, right? That's what I call it, user-friendly. And so if we supplement fish during pregnancy, or omegas, as we do here in the clinic, and then we get our kids on fish regularly as children, they're going to develop those skills much easier. So a good supply of nutrients from fish will allow the brain to develop to its maximum potential. This is according to one of the co-authors of the study, Caroline Taylor, who is an associate professor of nutrition at the University of Bristol. She says neurodevelopmental benefit might stem from one particular nutrient in the mix or from a combination. So there's no association that was noted between fish intake and IQ at the age of 8. The doctor said that several factors may have affected this finding. For instance, IQ tests may not have been sensitive enough to detect small changes in cognition, or a positive IQ change may have been countered by mercury and other toxins in the fish, which can have a negative effect on cognition. Now, I will just tell you, we are really, really particular with the fish oil that we bring into the clinic. We make sure that it is vacuum pulled to make sure that there is no mercury in it, all right? So there's a little test that you can do to see how your fish oil stacks up. So what you can do is you can put it in the freezer overnight. So take your bottle, put it in the freezer overnight. If it comes out cloudy, not shiny, because most fish oils, all the ones I've ever seen, are shiny, okay? If it comes out cloudy or with a matte finish, they've got heavy metals in there. So this is something that you can do at home with whatever fish oil that you have. Hopefully you're not getting it from the big box store. Hopefully you're not getting it from the grocery store or the pharmacy. Hopefully you're not ordering it online, okay? We want to make sure that you get really, really clean fish oil. And clean fish oil is expensive, okay? What we don't want to do is get the neurotoxins from the mercury and the other things that fish has in it, because it defeats the purpose of what we're doing with the fish oil. So there are nutrients in fish and fish oil for optimum neurodevelopment in childhood. So this depends on significant intake of fish for these nutrients. Now, fish and shellfish are primary food sources for omega-3 fatty acids, DHA, and EPA, which are vital for cognition. And this is why when we recommend for our pregnant ladies, when they're pregnant, we recommend a supplement that has a 6-to-1 ratio of EPA to DHA. And so that is because that is the most optimum form for neonatal brain development. And that's what we want. We want our kids to come out really, really healthy. So these are incredibly important nutrients, says Dr. David Berger, who is a board-certified pediatrician that was not involved in this study. He says their anti-inflammatory properties, the nutrients in fish, can reduce neuroinflammation that underlies a subset of childhood conditions affecting the neural system, such as autism and ADHD. They also can help non-neuroinflammation, which is beneficial in asthma and eczema, which is a rash with itching and bleeding. Now, we know that fish oil does help with eczema, but in my opinion, when you clean up the gut, the eczema goes away. And so I primarily see eczema as a gut issue, not a lack of omegas, although omegas are really, really good for the skin, and they are anti-inflammatory, and eczema is definitely an inflammatory disease. So earlier research that includes fish in the child's diet shows that the fish helps with the following. In a review of a study in pediatrics, it noted that most studies indicate that fish intake during pregnancy is likely to reduce the risk of childhood allergies, including eczema, asthma, allergic rhinitis, or cold-like symptoms from breathing in an allergen. Now, I just want to say with asthma, children that take a lot of aspirin or Tylenol have more asthma. Don't ask me why. I didn't pull up the research on that, but we do know that when you give your kids those fever reducers, it causes them to be more prone to asthma. So we really don't want to do that, right? What does a fever do in children? Well, in adults too. What does a fever do? The fever burns up the virus, burns up the bacteria, burns up the pathogen, whatever it is, and so you can get back to a healthy state. So when you squash the fever with Tylenol or Motrin or whatever you do, when you squash that fever, that pathogen is allowed to keep growing and replicating and that kind of thing. So while we don't want children to have really, really high fevers, we don't want adults to have really, really high fevers, the fever helps the body get rid of the pathogen, and so that's what we want to let the fever do its work. So they have seen that in the studies, they found that introducing fish in the diet in early childhood before 9 months of age, proved to be an advantage in allergy prevention. So we don't want to have our kids have allergies. It's one of the worst things, and we see kids all the time with allergies. Now, how are you going to get kids that are 9 months old, how are you going to get them to take a fish oil? Well, they're not going to take it in a supplement form because they can't swallow supplements, but they do make omegas, essential fatty acids, that are in a liquid form. And there is one supplement that I have. Now, I'm sold out of it now because the fish oil that they got in their last shipment, whatever it was contaminated, and so they rejected it, and so it's just not available right now. But my favorite fish oil has a slight lemony taste that you can poke a hole in it, put it in the kid's mouth. The kid absolutely takes it, likes it. There's no problem with it because it has that little bit of lemon flavor. I'm going to show you the fish oil that I take, and it tastes nasty. I'm just saying, it tastes nasty, but it's encapsulated, and as long as it's encapsulated, it's fine. So how do I know it tastes nasty? Well, I had it in a dish. I had it under a skylight, and one hot summer day, the coating on the capsule got a little gushy, and it sweated a little bit. And so when I took it out of the packet, I had fish oil on my hands, and it smelled, and I washed. It smells like fish. It's fish oil. I washed it under the tap to get the fish oil off, and no, it didn't work. Took the pills. I had fish oil all in my mouth, and it was nasty. That's how I know. Okay, so I changed my practice of having a dish right under the skylight, and I haven't had any problem since that. So what else does fish oil do for you and your children? So it boosts your IQ. Although the British study did not find a benefit of IQ in children, a few earlier investigations suggest that fish may have a positive effect in this area. A review in Pediatrics cited a study that found that kindergarten-aged children who ate fish 3 times per week had higher IQs than those who ate beef, chicken, or lamb. It also cited research that suggested a lower intake of fish, less than 340 grams per week, by mothers during pregnancy was associated with children with lower IQ, verbal IQ levels. So this is something that we need to be really, really cognizant of, is that if we're pregnant, if we're trying to get pregnant, if we have small children, we really want to make sure that they are getting this fish oil so that they're able to have their absolute very best cognitive scores on their tests, and they develop these social skills that they need in order to be successful. So the study also found that adequate intake of fish helped protect against Crohn's disease. Now, Crohn's disease is an autoimmune disease very much like IBS, okay, inflammatory bowel syndrome. Inflammatory bowel syndrome has not progressed to an autoimmune disease, although the symptoms are the same. Diarrhea, constipation, a lot of bleeding, a lot of lymphatic drainage through the bowel, all these kind of things, right? So we don't want to have any of that. So in the study published by Gastroenterology, investigated whether the ratio of omega-6 to omega-3 fatty acids could underlie an abnormal physiological effect that results in Crohn's disease. So just so you know, omega-6 are fatty acids from your plant-based. Omega-3s are fatty acids from your fish source, and so they're different. They work differently in the body. Most of us have too much omega-6 and not enough omega-3, okay? While the main source of omega-3 fatty acids is seafood, the source of omega-6 fatty acids includes unhealthy foods such as chips, fast foods, as well as healthy foods such as walnuts. And I think avocados also have omega-6 fatty acids in there. Now, we need fatty acids. I'm not against fatty acids at all. What we don't need is fatty acids in our fast food, right? Or let me rephrase that. We don't need fast food, okay? We don't need to be getting anything from fast food because you're getting all the preservatives, you're getting all the additives that are in there, the flavorings and all that kind of stuff. And if you're doing diet, if you're doing 0 calorie anything, you're getting industrial solvents, and those industrial solvents were never meant to be ingested by human beings. And so your brain doesn't understand that that is a sweetener, even though your taste buds do. And so it causes all kinds of a negative cascade in your brain. So you do not want to be doing that, okay? So we don't want to get our omega-6s from our fast food or our processed food, all right? Authors compared the dietary data from 182 children recently diagnosed with Crohn disease with data from 250 controls. Results indicated that those with a higher ratio of omega-6 to omega-3, meaning those who ate less fish, were more susceptible to Crohn's disease if they were carriers of certain gene variants that involve fatty acid metabolism. Eating more fish would result in a lower ratio of omega-6 to omega-3 fatty acids. So, there's more about the health benefits of fish, but there's also some things that we need to be concerned about. We need to be concerned about mercury that is in fish because we know that mercury is a neurotoxin. Now, I just have to say, as a kid, whenever we broke the thermometer, the fun thing to do was take that mercury, it balled up in a little ball, and we played with it. Nobody told us that that was dangerous. Nobody told us that that was really a toxic practice. I'm sure nobody encouraged us to do that, and that's why you can't find mercury thermometers anymore. Just going to throw that out there. But mercury, a derivative of mercury called thimerosal, is in your vaccinations. We don't want that. We don't want that in the body because it does cross the blood-brain barrier, and so we don't want to be eating that with our fish. According to a review in Pediatrics, the primary health risk from fish comes from the metal contaminant mercury. Prenatal and to a lesser extent postnatal exposure has been linked to deficits in children's attention, their IQ, their memory, their language, and their visual motor skills. Yet, as long as the fish intake of a child stays within recommended levels, the benefit outweighs the risk according to the doctors, the scientists, and all that kind of thing. The EPA offers a list of the best and good choices of fish as well as a list of fish varieties to avoid. Now, I'll post this list in the comments, and so you'll be able to check that out if you want to do that. It tells you what fish to avoid. We definitely want to avoid farm-raised fish. Why is that? Because of what they feed the fish. We don't want to have that. You know, just like we don't want to have scavenger food, we don't want to have farm-raised fish because of what they feed. All right. It is recommended that children eat 2 servings of fish per week from the list of the best choices. For example, that includes cod, flounder, haddock, salmon, tilapia, and white canned tuna. Now, I'm a little suspicious of tuna because tuna really ranks high among the mercury when they're being tested. So maybe when it's canned, it goes through some kind of a process that they remove the mercury. I'm not aware of that, but this is according to Dr. Berger. He recommends wild-caught salmon as it tends to have fewer contaminants than the farm-raised variety, and we just kind of covered that, didn't we? In a review of pediatrics, it noted that aside from mercury, fish also contains persistent organic pollutants. Okay, these are organic compounds that resist breakdown in the body. Now, these persistent organic pollutants, you know, we call them the forever chemicals, right? Because you just can't break them down. So, polyphenol, I can't say this word, polychlorinated bisphenols, PCBs, can negatively affect unborn and young children. Studies have linked them to the immune system dysfunction, low birth rate, obesity, asthma, and some forms of blood cancer. So we want to make sure. And now, you know, pretty much all of your plastics have BPA free that's stamped on them. And so that's what you want to look at. But you definitely do not want to be microwaving your food, full stop. But if you're rewarming something in the microwave, you don't want to do it with BPA plastics, all right? Those are things that leach the contaminants into your food, and you don't want to do that. Dioxins are another group of chemicals that are available. They're toxic pollutants. They cause cancer, they damage your immune system, and they harm development and reproduction. POPs are generally fat soluble, so they are present at higher levels in fatty fish and in the fatty tissue of leaner fish. Removing the skin before eating may decrease exposure. In contrast, mercury is stored in the protein tissue, so removing the skin does not alleviate your exposure to the mercury. So just make sure that your fish is from a good wild-caught source. Make sure that if you take fish oil supplements, that you have a very, very clean source. So fish and shellfish, especially the bivalve varieties such as clams, scallops, mussels, and oysters, can become contaminated with algae-produced toxins, which can cause several illnesses, some of which are very serious. Examples of the syndromes include neurotoxic shellfish poisoning, diarrhea shellfish poisoning, and paralytic shellfish poisoning. Now, I've never heard of that. I've heard of diarrhea, I've heard of different things, but I have not heard that eating shellfish could paralyze you. So that's just not a good thing. So the toxins are heat stable, which means cooking the fish does not eliminate the danger, okay? Sashimi, which is a form of sushi, okay, it is the raw fish and shellfish in the sushi, poses a higher risk of transmitting foodborne illnesses and worms. I'm just going to tell you that. People that eat sushi, that eat the raw fish, they've got worms. We don't want you having worms. Be careful what you do. If you're going to eat sushi, that's fine. Just do a parasite cleanse regularly, okay, because we don't want you having the worms in your body. Research has not established guidelines regarding the age at which raw fish should be introduced into the diet. I don't think I've ever done that. I'm just saying. I have had fish that I thought was not quite done, but I've never had raw fish to the best of my knowledge. So children who have not been regularly exposed to fish may be reluctant to try it. However, there are some kid-friendly foods, and they give us a list of recipes here that if you're interested in that, then we can post that. I don't know how you feel about that, if you have that. I remember being young, and my mom would make salmon patties, right? I remember her doing that. I don't know that that's the best form, but I do remember Mom doing that, and they're pretty good. Haven't had them in a very long time, but what we do have is we have options here. So this is a great brand. This is Transformations, and it has EPA and DHA in it, and it is probably the strongest formula that I have with 1.2 grams of fish oil, okay? This one is one that I like. It is a Pharmanex product, and it is called Optimum Omega, and I think it's 2,200 milligrams, okay? So 2,200 milligrams. So actually, this is a stronger one of that one. But then this is the one that I take. It's also a Pharmanex product, but this is my whole little packet. Okay, I take this twice a day. Why do I do that? Because I want to be healthy. So these are the vitamins that I take. 12-hour, it's a 12-hour component. So I take a packet in the morning, I take a packet in the evening, and these two lovely red pills, which are shiny, I don't know if you can see that, but they are shiny, and I did put them in the freezer, and they come out shiny. So I'm good on the heavy metal toxicity. There's no heavy metal toxicity. But I do 4 of these a day, and so 4 of these would give me, I think, two give me 2,000 milligrams, right about 2,000 milligrams. So I do 2. So I do 4,000 milligrams a day. So that's why my brain is good, because I keep it healthy with the fish oil. And fish oil is good for other things as well. What you want to do, the main takeaway from this is, yes, you need fish. Yes, you need fish when you're pregnant. Yes, you need to give your baby fish. Okay. And yes, you need to put it in the freezer. Pull it out of the freezer. If it's cloudy, it's no good. Throw it away. So there are brands, big box store brands, that are cheap. If you're having cheap fish oil, then you're not having vacuum pulled, where they pull all the mercury out. Now, my favorite, like I say, I'm sold out of it because I can't get it, because the manufacturers don't have the raw material in order to make it. But I know that one is from Canada, and it is vacuum pulled twice. It has absolutely no discernible mercury in it. And that's what you want, and that's what we give to our pregnant women, because it has the higher ratio. Usually on these, you've got a 1-to-1 ratio. On this other brand, it is a 6-to-1 ratio, which helps for neonatal development. And that's what we want. We want to make sure that our babies come out with as much brain power as they can, and we want to make sure that we foster that through their infancy, through their childhood, because it affects their IQ and it affects their social skills. So I don't know about these adults that are acting crazy. Maybe if we put them on a better fish diet, maybe that'll kind of make them more socially acceptable, more user-friendly. But I know certainly with our babies, we want to make sure that we do that. So that's a lot of information. The main thing to remember is put yours in the freezer, see how it comes out. The main thing to do is, if you're pregnant, if you're expecting, then we want to get you shored up with your fish oil. And if you have young children, you want to make sure that they do fish oil. I will just tell you, I have a grandson who the teacher said, he's got ADD, take him to the doctor, get him on a prescription. Well, Mama took him to the doctor, and the doctor said, no, there's nothing wrong with this kid. He's just an outdoor kid, and he don't want to be sitting at the desk. However, in order to pacify the teacher, we put him on that really good fish oil that I was telling you that I can't get anymore. We put him on that, and we put him on a different supplement that regulates brain function. And within about 2 weeks, the focus was there, all the things that were there. And so, fish oil helps at any age of development with ADD, with focus, with neuroinflammation, which is pretty much what ADD is. So that's a lot of information. Let me know if you need further help. And if I forget to post the list, remind me in the comments and I will get to it. Fridays are a little bit hectic after we do the program, and so I may forget. It is a weekend. Rest, recover, relax, replenish. Do all the things that you need to do so you can fight another day when Monday comes. Thank you so much for watching, sharing, commenting, all the things. And I'll talk to you next week.